Efficacy of a computer-aided detection system in a fecal immunochemical test-based organized colorectal cancer screening program, a randomized controlled trial, AIFIT study. Introduction. Fecal immunochemical test followed by a colonoscopy has demonstrated a reduction in incidence and mortality from colorectal cancer, CRC, and has been implemented as the preferable population-based strategy for CRC screening in Europe. As the risk of interval cancer has been associated with the adenoma detection rate, ADR, optimizing adenoma detection is crucial to increasing the effectiveness of CRC screening programs. For this purpose, new techniques and many technological devices that increase mucosal contrast and maximize mucosal exposure have been widely investigated over past decades, but their impact on ADR has been inconsistent across studies. Recently, computer-aided detection, CADe, systems based on artificial intelligence, AI, have been gaining increasing attention. AI-based systems have made significant progress owing to the development of deep neural networks and machine learning algorithms, especially in the area of computer vision. Convolutional neural networks are a class of deep neural networks that are highly effective in image and video analysis. Initial studies consistently showed that convolutional neural network-based systems effectively support the endoscopist in evaluating colonoscopy images, making the identification of colonic polyps easier. Most available studies on CADe are based on a primary screening and/or diagnostic setting, but no study has specifically looked at the potential benefit of CADe in fecal immunochemical test-based screening programs. This is relevant for two reasons. First, the fecal immunochemical test-positive population is characterized by a very high ADR due to enrichment with adenomas filtered out by the test itself. Second, before implementing a strategy in an organized population-based program, additional evidence is needed. The authors designed a prospective randomized controlled trial to assess whether the use of a CADe system affects the detection of adenomas in a fecal immunochemical test-based organized CRC screening program. Methods. In a multi-center randomized trial, fecal immunochemical test-positive individuals aged 50 to 74 years undergoing colonoscopy were randomized 1-to-1 to receive high-definition white light colonoscopy with or without a real-time deep learning CADe by endoscopists with baseline ADR greater than 25%. The primary outcome was ADR. Secondary outcomes were mean number of adenomas per colonoscopy and advanced adenoma detection rate. Subgroup analysis according to baseline endoscopist ADR was also performed. Results. 800 individuals were included. 405 underwent CADe-assisted colonoscopy, and 395 underwent high-definition white light colonoscopy alone. ADR and adenomas per colonoscopy were significantly higher in the CADe group than in the high-definition white light arm. No significant difference in advanced ADR was found. An increase in ADR was observed in all endoscopist groups regardless of baseline ADR. Conclusions. Incorporating CADe significantly increased ADR and adenomas per colonoscopy in the framework of a fecal immunochemical test-based CRC screening program. The impact of CADe appeared to be consistent regardless of endoscopist baseline ADR.